These aren't crazy conspiracy theorists. These are experts. Heads of their departments at prestigious universities, former government positions, health ministries, and whatnot. And they all seem to be in fairly good agreement about what the common sense thing to do is. So here's more, 10 more. I'll try to go as quick as I can. Dr. Sunetra Gupta and a bunch of others, their Oxford-based research team. So Oxford. Dr. Gupta himself is professor of theoretical epidemiology at the University of Oxford. Interest in infectious disease agents that are responsible for malaria, HIV, influenza, and blah, bunch of other things. Okay, so these guys, they say, importantly, the results we present here suggest the ongoing epidemics in the UK and Italy started at least a month before the first reported death and have already led to the accumulation of significant levels of herd immunity in both countries. There is an inverse relationship between the proportion currently immune and the fraction of the population vulnerable to severe disease. So already they're saying there's already a huge number, far more people already immune to coronavirus than those vulnerable to the disease. So we're already past the worst of it, they're saying, and we've already got a whole bunch of people immune to it in the meantime. So that's pretty good news. Except for bad news for Bill Gates, because he does not want that to happen. But sorry, Bill Gates, in the UK and Italy, it's already happened. Sorry, bud. Trying their damn hardest to make sure it don't happen in America, but it's probably happening in America too. Alright, so that was from 24 March. Okay, they also say the research presents a very different view of the epidemic to the modeling at Imperial College London. So I believe that was the projection of some mass number, millions of people going to die. Dr. Gupta says, I'm surprised that there has been such unqualified acceptance of the imperial model. Well, there was, but since then, actually, believe the UK health people kind of walked back that model and said, oh yeah, oops, that was a bit overhyped, and they actually downgraded this pandemic to a non-emergency level. I forget the specifics, but no longer at the highest level of alert. The disease is no longer as bad as they were originally, an emergency pandemic like they were saying before. So it's not now it's just been downgraded to just a normal flu type disease. So the media doesn't really report on that very much either. They still love to use this Imperial College London modeling. Anyway, he also, or these paper also says the Oxford results would mean the country, UK, had already acquired substantial herd immunity through the unrecognized spread of COVID-19 over more than 2 months. There we go again. Substantial immunity in the majority of people. Although some experts have shed doubt on the strength and length of the human immune response to the virus, Professor Gupta said the emerging evidence made her confident that humanity would build up herd immunity against COVID-19. So this right here is what Bill Gates and co. do not want you to hear. They don't want you to hear that doctors, professionals in their field, professionals, experts in infectious diseases believe the majority of humanity is going to build up immunity against this. They don't want you to know that. They want you panicking instead. Oh, no, we need that. We need that vaccine. We need that lockdown. We need that social distancing. Social distancing. No, you don't really need that social distancing, guys. And for all you know, you've already gone through it. You never got so sick you needed to go to the hospital. Maybe you just thought it was a cold and you're already immune. Like, that's what they're saying. A lot of people, too, they went through mild symptoms, built up immunity without even knowing that they had the virus. So it's not even as bad in a lot of people as they're making it out to seem like, as other doctors already said. Okay, Dr. Karen Moling, another German virologist whose research focused on retroviruses, particularly HIV. She was also a professor, Institute of Medical Virology at the University of Zurich for almost 20 years, or 15 years or so. She received multiple honors and awards for her work. So again, another expert in the field. What does she say? She says, "You are now told every morning how many SARS-CoV-2 deaths there are." Yeah, you sure are. They make sure you know. And they make sure the numbers keep rising. But they don't tell you how many people already are infected with influenza this winter and how many deaths it has caused. No, they sure have not. According to the CDC, in America alone, between 24,000 and 62,000 Americans have died from the influenza between October and the end of March in that 6-month period. They don't tell you that though. Nope. Because then people would ask, why was there no panic for that? And yet there is for this. Okay, so this winter, the flu is not even all that severe, she says, but around 80,000 are infected. It's a lot of people. You don't get these numbers at all. Something similar occurred 2 years ago. This is not put into the right context. No, it's not put into context. It's made to seem as if it's way, way, way worse than it really is, were you to put it in context. She says every week a person dies in Berlin from multi-resistant germs. Every single week. That adds up to 35,000 a year in Germany. This is not mentioned at all. I believe that we have had situations like this several times, and that the measures are now being taken too far. I am of the opinion that maybe one should not do so much against young people having parties together and infecting each other. Oh my gosh! She thinks we should not have social distancing between the young people so much. We have to build immunity somehow. Yes, unless your goal is actually to have more people get sick and die later. Unless your goal is to sell vaccines, like Bill Gates, Johnson & Johnson, Donald Trump, on and on. All of Big Pharma. Anyway, this is a doctor talking common sense about actually what we need to do for the health, not for the money of the rich and the elite and the corporate world and the government. No, what we have to do for the health of the common person. We have to build immunity, not wait for a stupid frickin' vaccine 18 months down the line. How can that be possible without contacts? In other words, how is it possible if everyone social distances themselves? Like they're pushing so rapidly. The younger ones handle the infection much better. But we have to protect the elderly and protect them in a way that can be scrutinized. It is reasonable what we are doing now to stretch out the epidemic in a way that almost paralyzes the entire world economy. It's a good question. Is it reasonable what we're doing? No, it's not reasonable for anyone except the bankers and the government and the big corporations that are getting the majority of that $6.2 trillion. It's not reasonable for the average hardworking American. It's not reasonable for any average American or anyone around the world. It's just not. Anyway, she or he, I forget, is it a he or is it a she? I feel bad now. Yeah, she. It's a she, I was right. She goes on to say, the Robert Koch Institute provides the figures. Then you sit there as a listener or spectator. 20 dead again. How terrible. Do you know when I would start to panic? She says. If there are 20,000. And then we get close to what went on completely quietly 2 years ago. So, I wouldn't be surprised if soon it reaches that, official number reaches that. Doesn't mean that's actually the number being killed by the virus, as we've already talked about. But Even then, if we start to reach 20,000 and above, then we're only beginning to reach what happened 2 years ago and went by quietly, with no panic, and no martial law, and no social distancing, and no $6 trillion bailouts, and no 5G being pushed out, while everyone's locked at home and has no idea it's going on, and no ID 2020 being pushed through, no trying their hardest to get digital currency because you can't touch that dirty cash. Gonna get you sick. Even though it's probably just gonna help build your immunity, according to these doctors. Anyway, yeah, it hasn't reached that yet. It's maybe getting close now worldwide, but the numbers are, as we've shown, hyped up. And even if it passes that went by with nothing. And we've been panicking, our media, for over a month, when the numbers were only at 50 deaths. It's ridiculous. Anyway, the 2018 influenza epidemic with 25,000 deaths never disconcerted the press, she says. The clinics had to deal with an additional 60,000 patients, which was no problem in the clinics either. It wasn't a problem. So why, when we have less numbers here, are the media going nuts about, the hospitals, they're overflowing with people, the refrigerator trucks are coming up, they gotta take away because the people are dying so fast? Doesn't even seem possible, because we've had way more deaths from such an epidemic before, and yet never happened. Never overflowed the hospitals, never needed all these extra respirators. It's crazy. It's like they're pushing fake news almost, which they would never do, because it's not like they do it all the time anyway. Except they do. Anyway. Yeah, New York, it's real crazy over there in New York. They got everyone and their mother on the news crying about not enough ventilators. Even the governor himself. And except the governor himself has even admitted he's hoarding them all. They're not going to be released until they're really needed. Well, are they really needed or not? Media's not going to ask those questions. It's ridiculous. It's ridiculous. Ridiculous. So, she says that is the main fear. The disease is presented as a terrible disease. It sure is. The disease per se is like the flu in a normal winter. It is even weaker in the first week. Even weaker than the normal flu. So, yeah. Seems to be a reoccurring theme that all these experts agree on. It's not that bad. It's just like the common flu. Dr. Anders Tegnell, Swedish physician, civil servant. He graduated from medical school in 1985, specializing in infectious disease. Okay, so he says, all measures that we take must be feasible over a long period of time. Otherwise, the population will lose acceptance of the entire corona strategy. Older people or people with previous health problems should be isolated as much as possible. Older people or people with previous health problems should be isolated as much as possible. So no visits to children or grandchildren, no journeys by public transport, if possible, no shopping. That is the one rule. The other is, anyone with symptoms should stay at home immediately, even with the slightest cough. If you follow these two rules, you don't need any further measures, nothing else, the effect of which is only very marginal anyway. So the measures don't really even do that much, as another one of these experts already pointed out. But his two rules not social distancing for everybody, just for the old people that are at the highest risk. My goodness. And of course, if you have symptoms, stay at home. Or go to the doctor if they get bad. Anyway, Dr. Pablo Goldschmidt, Argentine-French virologist specializing in tropical diseases, professor of molecular pharmacology at the Université Pierre et Marie Curie in Paris. So he's from France. So he's a graduate of the Faculty of Pharmacy and Biochemistry of the University of Buenos Aires, also, and a Faculty of Medicine Hospital Center of Pitié-Salpêtrière, Paris, France. Okay, so what does this good Frenchman doctor say? He says the ill-founded opinions expressed by international experts, replicated by the media and social networks, repeat the unnecessary panic that we have previously experienced. The coronavirus identified in China in 2019 caused nothing less than a strong cold or flu, with no difference so far with cold or flu as we know. Respiratory viral conditions are numerous and are caused by several viral families and species, among which the respiratory syncytial virus, especially in infants, and the influenza, common flu, human metapneumoviruses and adenoviruses, rhinoviruses, and various coronaviruses already described years ago. So there's a lot of things that strike people down in the similar boat. Similar types of diseases that are, take people out. A lot of them. A lot more than just this one. You wouldn't know that listening to the media, though, would you? It is striking that earlier this year, global health alerts had been triggered as a result of infections by a coronavirus detected in China, COVID-19, knowing that each year there are 3 million newborns. 3 million who die in the world of pneumonia. And 50,000 adults in the United States for the same cause without alarms being issued. Pretty serious. It's very serious that they're hyping this up way beyond what it really is. There's so many other things that are worse at this point. And you add them all together, and they're all together gonna stay worse than this will, even if this continues to get worse. How come those didn't cause crazy panic? How come those didn't cause a $6 trillion stimulus package for the bankers and the corporations, and they didn't cause lots and lots of millions of dollars getting dumped into testing kits? Testing. We gotta do testing for everyone, pay for our expensive testing kits, and Trump getting up there and selling them. All the politicians selling the pharmaceutical testing kits. How come none of that happened for the flu? For pneumonia? And while you're at it, why not even a bigger cause of death? Doctors. Yeah, medical malpractice, what, is the third highest cause of death in this country, I believe? Alcohol's up there. And prescription drugs. Yeah, Big Pharma. One of the number one killers in this country. How come no panic for none of those? Huh, guys? Why not? Well, I think everyone knows the answer by now. Why not? Because the media and the government, they're little puppets, little shills for the Big Pharma. For all those industries. And they have agendas to push. This is just an excuse for them to push their agenda. It's a plandemic, all planned out. Event 201. Doesn't mean it's a hoax. Just means the agenda is pre-planned and they use this as their opportunity. Clearly. So it goes on to say, our planet is the victim of a new sociological phenomenon. Scientific media harassment. Yep. Triggered by experts only on the basis of laboratory molecular diagnostic analysis results. Communiques issued from China and Geneva were replicated without being confronted from a critical point of view, and above all, without stressing that coronaviruses have always infected humans and always caused diarrhea and what people call a banal cold or a common cold. Absurd forecasts were extrapolated, as in 2009 with the H1N1, the swan flu. There is no evidence to show that the 2019 coronavirus is more lethal than respiratory adenoviruses, influenza viruses, coronaviruses from previous years, or rhinoviruses responsible for the common cold. No evidence. None. It's important to realize that. Americans are being played. Anyway, Dr. Aaron Bandavad and Dr. Jay Bhattacharya, professors of medicine and public health at Stanford, America's own Stanford University. They have this to say: projections of the death toll could plausibly be orders of magnitude too high. The true fatality rate is the portion of those infected who die, not the deaths from identified positive cases. The latter rate is misleading because of selection bias in testing. The degree of bias is uncertain because available data are limited, but it could make the difference between an epidemic that kills 20,000 and one that kills 2 million. Which one do you think the media is going to hop on, though? They're probably going to hop on the 2 million number, not the 20,000 number. So I don't quite fully understand what he's saying, but I think what he's saying is, yeah, it's the portion of those infected who die, which is very different from the deaths from identified positive cases, because there are a whole bunch of people that are never identified that actually have it. So again, others have already been over this. He's just wording it in a different way. But yeah, he's basically saying that same thing. So the true fatality rate is the percentage of everyone who has it, not everyone who's been tested positive for it. Because a lot of people have it and they're not tested positive. Okay, so with that being clear, he also says, a universal quarantine may not be worth the cost it imposes on the economy, community, and individual mental and physical health. As Donald Trump pointed out well the other day, we should undertake immediate steps to evaluate the empirical basis of the lockdowns, the current lockdowns. Media's not calling for immediate steps to be taken to evaluate the basis of the lockdowns. Donald Trump's not. He's suggesting they continue, as are most of the politicians. Interesting. They're supposed to represent the people. It seems like in these days, the doctors actually care more about the people than the politicians. Just crazy, considering doctors themselves are a high rate of death, medical malpractice, but still doctors in general are still care and still way less dangerous than government. So, it's pretty crazy out there. I went to town today where I'm at, camping near Silver City, and the Walmart, they've got this maze. You gotta walk through this maze now to get in the Walmart, and they got you going in backward. You gotta go in the exit and leave through the entrance. And you gotta walk through this long maze. I don't know why. It doesn't really make any logical sense. But there's signs everywhere you go now. Social distancing, stay 6 feet apart. They're really pushing it hardcore, and yeah, it's just crazy. It's definitely, it's all out mind control. It's how blindly will people accept whatever they say, no matter how illogical it is, and how many people will turn into snitches on their neighbors in places where it's actually been mandatorized by edict, by executive order, by law, by these tyrants. Because that's what they're pushing now. The old saying, snitches get stitches. Well, we got a new saying for you now. Snitches get rewarded. Yeah, that was an actual, I think it was the governor of New York, mayor of New York, I forget, but it's crazy what they're pushing now. Also, wash your hands. Don't forget to wash your hands. Wash your hands. Wash your hands. In case you didn't realize, it's important to wash your hands every day, all the time, all day long. Even though overwashing your hands actually lowers your immune system. Because if you don't ever get any dirt into your system, then you don't build immunity for stuff. But wash your hands, wash your hands, wash your hands, wash your hands. Yeah, it's so crazy. When I was in town, we had a guy drove by. I think he was joking because he looked like he was laughing. But he yelled out his window at me as I got out of my car. He's like, "Don't forget to wash your hands!" And that's just what they're pushing right now. Don't forget to wash your hands, as if people are morons and never knew that you're supposed to wash your hands. Like, it's crazy. It's like I said, it's mind control. And it has nothing to do with the coronavirus. It has everything to do with agenda, a pre-planned agenda. It's a pandemic. Anyway, Dr. Tom Jefferson, getting back to the actual experts here instead of my observations from my recent drive into town, which is a little crazy and disconcerting. Anyway, he says he's a British epidemiologist based in Rome. Okay, so he's an advisor to the Italian National Agency for Regional Health Services. He says, "So I cannot answer my nagging doubts. There does not seem to be anything special about this particular epidemic of influenza-like illness. There are, however, two consequences of the situation that bother me. First is a lack of institutional credibility as perceived by my friends. They range from firefighters, policemen, and even the GP. Not sure what the GP is, but not the kind of people you would want to alienate in an emergency. A restaurant owner told me he would never report himself to the health authority, as that would mean at least 2 weeks of closure, and his business would go to the wall, as is happening to a lot of people in America right now. He says the second reason is that once the limelight has moved on, there will be a serious and concentrated international effort to understand the causes and origins of influenza-like illnesses and the life cycle of its agents. Will there? Well, he says past form tells me not. No, there will not be. And we will go back to pushing influenza as a universal plague under the roof of the hothouse of commercial interest. Yeah, like, get your flu shot. I think that's what he's talking about when he says commercial interest. I'm not 100% sure, but yeah, they've been pushing that for a while now, even though a lot of people get the flu shot, get the flu because it gives them the flu, or it just doesn't work because there's too many different flus out there, too many different influenzas. They can't vaccinate against all of them. Commercial interest, you gotta love how everything in America is based on the commercial interest. Not of you or me, mind you. Not your average small business. Not even your average medium business. They want those all shut down. But the commercial interest of Walmart, Costco, McDonald's, Burger King, they get to all stay open during this pandemic. They get to keep serving their poison, those fast food joints, while all the good mom and pop restaurants get shut down. It makes a lot of sense, doesn't it? It makes a lot of sense for the corporations. Doesn't make a lot of sense for the average human being, though. But clearly, these folks at the top, they don't care about humanity. They care about the corporate interests. Should be obvious by now. Anyway, he says note the difference. Influenza, caused by type A and B viruses, for which we have licensed vaccines and drugs. Not influenza-like illnesses against which we should wash our hands all the year round, not just now. Meanwhile, I still cannot answer Mario's question. What's the difference this time? So he's basically saying there's influenza-like illnesses all year round that we should be washing our hands for. Just like the coronavirus, it's an influenza-like illness. But for some reason, this specific one triggered a whole bunch of stuff, including the whole don't forget to wash your hands. Wash your hands after you eat. Wash your hands after you go to the bathroom. Wash your hands after you touch your car. Wash your hands really, really good. Make sure you follow all 9 steps. Scrub between your thumbs now. Don't want to make any sure there's no dirt left. You gotta get it all. Scrub, scrub, scrub. If you don't think you got it good enough the first time, repeat. Wash your hands again. Yeah, and in case you didn't realize how important it is, in case you forgot since 2 minutes ago when we told you that you needed to wash your hands, yeah. Don't forget, wash your hands, buddy. Wash your hands, guys. Wash your hands, wash your hands. Wash your freaking hands. Yeah, it's freaking crazy. Anyway, Dr. Michael Levitt, professor of biochemistry at Stanford University, so another Stanford specialist, he correctly modeled that the China outbreak was coming to an end. He predicted around 80,000 cases and 3,250 deaths. Apparently his model was pretty correct, pretty close to accurate, so probably should listen to him. He said, I don't believe the numbers in Israel, not because they're made up, but because the definition of a case in Israel keeps changing and it's hard to evaluate the numbers that way. There's a lot of unjustified panic in Israel. I don't believe the numbers here. Everything is politics, not math. I will be surprised if numbers of deaths in Israel surpasses 10, and even 5 now with the restrictions. To put things in proportion, the number of deaths of coronaviruses in Italy is 10% of the number of deaths of influenza in the country between 2016 and 2017. Is 10%. 10% of the common flu And yet Italy, we're being told, is the deadliest place of coronavirus in the whole entire freaking world. And yet it's still only 10% of influenza. We're being scammed, guys. We are being scammed. He says, even in China, it's hard to look at the number of patients because the definition of patient varies. So I look at number of deaths. In Israel, there are none. So that's why it's not even on the world map for the disease. So he's obviously, that was featured in the good old Jerusalem Post, 20th of March. He says, surprised if Israel, apparently a Nobel laureate, and he was quoted in the headline, surprised if Israel has more than 10 coronavirus deaths, as he said. So, yeah, even in places where there's like no deaths whatsoever, it's still being hyped like crazy, at least in the West. So that's Israel. Levitt analyzed data from 78 countries that reported more than 50 new cases of the COVID-19 every day, and he sees signs of recovery in many of them. So that's good. Of all the new cases, many of them are recovering. He's not focusing on total numbers, rather on the number of new cases identified every day, and especially on the change in that number from one day to the next. He says numbers are still noisy, but there are clear signs of slowed growth. Slowed growth. Not massive increase, but slowed growth. Kind of the opposite of what the media is trying to sell us. Anyway, he also says what we need is to control the panic. Not the disease, the panic. You don't say, guys. It's getting out of control, man. Wash your hands. Wash your hands. Yeah, he also said that in the grand scheme, we're going to be fine. I think so. We are going to be fine. If we can ever bounce back to a normal, halfway normal society, we'll be just fine. But will we? Or is this going to be is this the new normal forever? We're going to have ads constantly everywhere we go. Wash your hands. Wash your hands. Wash your hands. Yeah, you're not 6 feet apart. You're going to get arrested. I'm calling the cops on you because you coughed. You coughed. Is this really going to be the new normal? Because that's not fine. But as far as the virus goes, this expert says we're going to be just fine. So again, all this nonsense over something that's not even going to cause a long-term problem. Yeah. All right, I think this is the last one. German Network for Evidence-Based Medicine is an association of German scientists, researchers, and medical professionals. They say, in the majority of cases, COVID-19 takes the form of a mild cold or is even symptom-free. Mild cold or is even symptom-free. That's the majority of cases. Of this pandemic, mind you. I think that's important to note. Important to really get, really realize, because the media is not going to ever say this. In the majority of cases, COVID-19 takes the form of a mild cold or is even symptom-free. All right, hopefully, having repeated that twice, now we can begin to actually comprehend that the media is blowing this way out of proportion. He says, therefore, it is highly unlikely that all cases of infection are recorded, in contrast with deaths which are almost completely recorded. This leads to an overestimation of the CFR, as I mentioned briefly earlier. That's the death rate. I think he'll mention what this specific CFR stands for, but it's the percentage of people dying. According to a study of 565 Japanese people evacuated from Wuhan, where they claimed it started, all of whom were tested, regardless of symptoms, only 9.2% of the infected people were detected with currently used symptom-oriented COVID-19 monitoring. This would mean that the number of infected people is likely to be about 10 times greater than the number of registered cases. The CFR would then only be about 1/10 of that currently measured. 1/10 of the official numbers, he's saying. quite a bit less. Others assume an even higher number of unreported cases, which would further reduce the CFR. The mortality rate. The widespread availability of SARS-CoV-2 tests is limited. In the USA, for example, an adequate state-funded testing facility for all suspected cases has only been available since 11th of March. In Germany as well, there were occasional bottlenecks which contribute to an overestimation of CFR. As the disease spreads, it becomes increasingly difficult to identify a suspected source of infection. As a result, common colds in people who unknowingly had contact with COVID-19 patient are not necessarily associated with COVID-19, and those affected do not even go to the doctor at all. An overestimation of the CFR also occurs when a deceased person is found to have been infected with SARS-CoV-2, but this was not the cause of the death. The CFR of 0.2% currently measured for Germany is below the Robert Koch Institute's calculated influenza CFRs of 0.5% in 2017-18 and 0.4% in 2018-19. So, this is a lower mortality rate, according to the testing done in Germany, than the common flu. But it's above the widely accepted figure of 0.1%, for which there is no reliable evidence. So basically, they are quoting the 0.1% when they talk about the flu, but there's no evidence for that. That's almost, according to this expert, that's a lower. Been underinflated. But the coronavirus has been overinflated. So then when you compare the overinflated number with the underinflated number, it seems way worse. In reality, coronavirus is actually not even as bad as the reality of cases of people dying from the flu, percentage-wise. Beyond the rather questionable conclusions drawn from the historical example, there is little evidence that the MPIs for COVID-19 actually lead to a reduction in overall mortality. Cochrane review from 2011 found no robust evidence for the effectiveness of border control screenings or, here it comes, social distancing. Yeah, you heard that. Study from 2011 found no evidence for the effectiveness of social distancing. Yeah. So wonder why they're pushing social distancing so much, huh? I don't know why. You can come to your own conclusion as to why, but the fact is there's no evidence that it actually works to really slow the virus that much. Yet that's one of the main things besides testing. They want you tested, and they want you social distancing, and they want you to wash your hands. Yeah. Okay. Systematic review from 2015 found moderate evidence that school closures delay the spread of influenza, but at a high cost. This is what they're doing for the coronavirus. So he says, isolation at home slows down the spread of influenza, but leads to increased infection of family members. It is questionable whether these findings can be transferred from influenza to COVID-19. It is completely unclear how long the NPIs must be maintained and what effects could be achieved depending on their duration and intensity. So in other words, they have no idea of the effectiveness and how long and how intense these measures have to be to work if they're even maintained and if they even are effective. The number of deaths might only be postponed to a later point in time, without any change in the total number of actual people dying due to all these social distancing measures. It might not even do anything except postpone when we get through this. So that lengthens the length of time of the pandemic, which of course draws out the economic crisis, which of course makes no reasonable sense, but it's what happens. It's what's happening. So anyway, many questions remain unanswered. On the one hand, the media confronts us daily with alarming reports of exponentially increasing number of ill and dead people worldwide. That's the one hand. But on the other hand, the media coverage in no way considers our required criteria for evidence-based risk communication. The media is currently communicating raw data. For example, there have been X infected persons and Y deaths to date. However, this presentation fails to distinguish between diagnoses and infections. So basically, the media is giving you numbers that don't match reality. And what they're pushing, social distancing and wash your hands and stay home, in no way considers the required criteria for actual evidence-based risk communication. Basically, the media is not up to par with communicating to the public actual evidence-based risk information regarding the virus. So basically, the media is giving you false information, information that's not backed by evidence. So that's interesting, because that should be obvious by now. Dr. Richard Scabis, the Ontario guy, another Canadian, he says far more cases are out there than are being reported. We've heard that before. This is because many cases have no symptoms and testing capacity has been limited. There have been about 100,000 cases reported to date. But if we extrapolate from the number of reported deaths and a presumed case fatality rate of 0.5%, the real number is probably closer to, 2 million. The vast majority mild or asymptomatic. Just like another doctor study said. The majority of the people that are getting this have cold-like symptoms or no symptoms at all. Likewise, the actual rate of new cases is probably at least 10,000 a day. If these numbers sound large, though, remember that the world is a very big place. From a global perspective, these numbers are very small. So when the media gives you a number, they make it sound huge because it is a huge number. What they don't tell you is that in perspective is tiny. That's what the media doesn't tell you. So, second, the Hubei outbreak, by far the largest and a kind of worst case scenario, appears to be winding down. How bad was it? Well, the number of deaths was comparable to an average influenza season. That's not nothing, but it's not catastrophic either, and it isn't likely to overwhelm a competent healthcare system. Not even close. So why is New York's healthcare system, we are being told, being completely overwhelmed? One wonders. One also wonders why when the locals go and look, it doesn't look overwhelmed. It only looks overwhelmed when the mainstream media seems to be filming these hospitals in New York. Crazy how that works. It's almost like there's these people. Let's call them CAs, because if I say the actual word, I get in trouble. But the CA, short CA, they might be CAs. They might be, what do you say, stand-ins. They might be hired. Just saying, maybe not. Maybe these long lines and for getting tests, all these testing tents in New York hospitals being showed all over the media. Maybe there really are these long overflowing lines, and maybe the media just knows the only time of day when these long lines are there, and then the rest of the day not a single person getting tested. That doesn't seem like a pandemic either. That almost still seems like CAs, like these people that I can't call what I want to call, or else I'll get my YouTube video taken down. But hopefully you get the point. I don't know if that's what's going on, but clearly what is going on is that they're lying to us over and over and over on so many different issues. And they're producing fake media like CBS News did, putting Italian hospital footage in their reporting on the New York hospitals. Or was it even an Italian hospital? Was it a stage set somewhere in Los Angeles for who knows? Who really knows? he's not preaching complacency. This disease is not going away anytime soon, he says. We should expect more cases and more local outbreaks. So it's not a hoax. I never said it was a hoax. Media likes to paint people who question the official narrative as hoaxers. I'm not saying it's a hoax, guys. Neither is he. He is saying that COVID-19 still has the potential to become a major global health problem with an overall burden comparable to that of influenza. Need to be vigilant in our surveillance. So we need to not be retards. If we have it, don't go out and get other people sick. If you're old, maybe you should stay home. Take logical, reasonable precautions. Just don't be panicking, because it's comparable to the flu. But we also need to be sensible. Quarantine belongs back in the Middle Ages. Save your masks for robbing banks. Stay calm and carry on. Let's not make our attempted cures worse than the disease. Sorry, folks, I think they've already been made worse, but let's listen to this guy. This is really, really, really good. Quarantine does belong in the Middle Ages. I'm kind of getting sick and tired of seeing all these retards wearing masks everywhere because they're so freaking terrified of something that's not even as high of a death mortality rate as the common flu. Mazes to get into your local grocery stores. Gotta enter through the exit and exit through the entrance. This is what a police state looks like. This is what mind control looks like. People wearing their masks everywhere like they're robbing banks. But they're not. They're paranoid about something that's not anything worse than anything that they've been through year after year, every single year of their life. And yet none of those other years did they wear a mask all flu season. Why? Because the media didn't tell them to. Why are they doing it now? Because the media is telling them to. They don't think for themselves. They do what the media tells them to do. They think what the media tells them to think. And they act how the media tells them to act. The media says wash your hands 150 million times a day. They'll wash their hands all day. They won't ever get up to 150 million, but they'll still try. Because the media said so. The media says be happy that you're stuck at home. They'll be happy. I guess. But that's what's going on. What should be going on is we should be calm and carrying on. Like normal. Like human beings. Not like mind-controlled slaves. Come on, guys. Don't make this stupid attempted cure that's not going to do anything worse than the disease. Get back to normal. This is not the new normal. This is not normal at all. Walking through mazes to get into your store, having to go through the exit and come out the entrance. Why? Because they say so. Why? Well, there's no reason. Because of coronavirus. That's why. Because of social distancing. Because of... There is no reason. It's mind control. There's no reason. Wash your hands, though. Don't forget to wash your hands. Anyway, so that's all for this. Sorry it was such a long video, but that's a lot of 22 experts and a little bit of my own observations. So don't go crazy out there. Hope you're not going insane, because there's a lot of insanity out there. And that last point was a good one to end on. Just don't panic. Carry on like normal. Try not to freak out about all the bad negative agenda stuff either. That's not good either. Just try to get back to normal. Government's evil, sure, but don't focus on it. Don't feed them. And really don't feed the system with your fear. If at all possible, just rise above the fear, guys. It's important to rise above the fear and unite. Humanity unite, not be divided by all this social distancing. So that's, I think, what's going on. They're dividing us so that we all have to be sectioned off into our own isolated little bubble, because apparently when you're 6 feet away from someone, germs in the air somehow can't travel in the air anymore from 6 feet away. Yeah, I don't know. That's, like I said, none of it really makes any sense. It's all an agenda. Why? Some of the things don't even make sense of why it's a part of the agenda. It just is, and it's stupid, and it's ridiculous, and hope you're staying sane out there. Hopefully these experts help you realize that you don't need to be panicking, and hopefully you can share these articles with people that you may know, friends and family that maybe are panicking, because panic leads to sickness, stress leads to disease. So anyway, I'll have the links in the description box below. Yeah, hope you guys have a good one. Stay safe, stay sane, don't panic. Hope you found this useful. Links in the description below. Till next time, this has been Jason. Peace.